You probably should have some paper and pencil of some sort if you want to take notes. There are going to be a few activities that I'm going to ask you to do down the road. So let's enjoy this together. All right. I am going to ask you guys via chat, what does dementia mean to you? Oh, no, I'm not going to be able to see my chat. All right. So apparently my chat is not coming in. What I might have to do is there we go. All right. So a lot of people are saying, and if you guys can see the chat, short-term memory loss, forgetfulness, loss of memory, disappearance, being the parent for your parents, something that's robbing you of your personhood, your connection with others, decline in memory. You guys are, I mean, obviously I'm speaking to the choir about this because that's exactly what it is. Feeling lost, making sure that, and the frustration of it all. So as we go through, tell me if you guys recognize any of these feelings. So behaviors, go. Memory loss, fear, frustration, and all of you guys have said all of these things. A lot of times people say they get so frustrated because they just don't understand what I'm trying to say. Confusion. It's just a part of getting older. No big deal, which it's not, and we're going to talk about that later. It's very emotional, and this could be emotional for both you and the person who's going through dementia. So what my goal is for you guys is I want you guys to try to think of it in a different way. I want you to try to look at things and see if we can change those negative words into some positive words and some positive feelings. And I know that that sounds a little difficult because when you're in the midst of dementia, it is a very difficult thing. But finding the joy in everything that you see. The little times that are the laughing times, the little moments that they're focused and they're able to be present in that moment. Being able to kind of take that and look at that and hold on to that. Realizing that we do have to change our version of what we know as our communication or togetherness. With that being said, we need to hold on to that togetherness. Enjoy the time that we're together and not have to have the words that used to be there. Having the feelings, the touch, the smiles, the nods, those kinds of things. That's what's really important to be able to change our lifestyle and to change how we're getting along with others. So the quality of life. Sometimes I work with many different realms, many different people, and they focus on mom. I know you remember this. They want it to be right. They wanted to have that make it the way it used to be, and it's not the way it used to be. Dementia is something that robs our life, and when they're not doing it the way you expect them to do, sometimes we get frustrated in that. And they get frustrated in that. And really, it's a form of, do you want to be right or do you want to be happy? We can all be right, and we can push that to the extent where it's, then it becomes uncomfortable. But if we're changing our view and changing our mind of how we see things, maybe being happy is okay. And letting them be where they're at is okay. Also, being able to educate yourselves and finding things like this and things on the internet and people who, you know, are going through the same types of things, that is very helpful as well. All right. So dementia is actually a group of symptoms. A lot of times dementia gets intertwined with the words Alzheimer's or with the word Alzheimer's. They become very intertwined, and people will say, well, my mom has Alzheimer's, but she doesn't have dementia. And that's really a fallacy. What it is dementia is this group of symptoms. And you can see on the screen, there's about 5 symptoms that are regular throughout every dementia. One of them is memory. And memory is a huge part of dementia, and that's why it's known more. Communication and language. And being able to share, being able to have that moment of being able to understand what people are saying to you, as well as expressing what you need to be expressed to them to make sense. The ability to pay attention and focus, that is hindered. So we don't have that ability anymore. It is shortened attention. It is not being able to pay attention and going from one item to another item or one task to another task very quickly and intermittently. The reasoning and judgment, this is greatly affected as well. Reasoning, anything from it being 102 degrees outside and you're putting on 3 coats to looking at a recipe and not being able to understand what a cup is versus a half a cup or a teaspoon versus a tablespoon. So any of those things and anything in between can be affected. And then visual perception. And visual perception is something that is where you see your face and your space in your body in space. So how you find a chair and sit in it and know that the chair is behind you when you're getting ready to sit. Or if you have a glass of water and you're trying to put it on the table and can't quite get it to the table and you maybe have it fall. Those are all visual perception type things. One thing that I am terrible at, I don't know how many of you guys do this, but when you are moving so fast and you run around the corner and you run into the wall or a door and you hit your arm or your shoulder or your leg or something like that, that happens to me all the time. And I don't have dementia, but I do have a visual spatial problem apparently. So that's kind of what that is. So all dementias have those 5 things in common. So if I were to say, for example, I have a runny nose, I have itchy, watery eyes, I have a sore throat, maybe some itchy ears, tingly ears. Some people might diagnose that with maybe a cold. Some people might diagnose that with allergies. Maybe flu symptoms, maybe a sinus infection, those kinds of things. All of those things, we're going to call them quote unquote diseases. They all have the same signs and symptoms. So how do we know kind of exactly what we're looking at? Well, we have to dig deeper. And it's the same thing with dementia. All of those dementias are across the board. We have to look deeper into behaviors, into background, into history, and all of those kinds of things to find out exactly what we're looking at. And so, let's see here. These are some of the diseases that you can see that are the most popular. So as you can see, Alzheimer's disease is about 60 to 70% of all dementias. Alzheimer's, mild cognitive impairment, vascular dementia. As you go through this list, this is, like I said, just kind of some of the basics. those are the basic ones that have all of those symptoms. Alzheimer's, again, is about 60 to 70%, depending on what study you look at. That's why we hear about it more often. That's why it's more known. We don't hear about some of the other dementias that are there, but they all have the same types of symptoms. So we're going to look at this brain. This brain is, there's two different brains. The one on the left is a healthy, normal brain. The brain typically weighs about 3 pounds. This brain is probably from an average age of about 35 years of age that is normally developed. So I want you to look at the left one on the top and then compare it to the right one on the top. And you can notice the differences. So one of the differences is very obvious, is that the brains on the right side, they're kind of unfolding. They're a little bit looser. They're also smaller. And you can see the differences. The little walnut part on the left-hand bottom side of the brain, it looks kind of like a walnut. That's called our cerebellum. Our cerebellum is what hosts or what helps our bodies be able to move. So it's everything motor related in our body. And you can see how on the left side it's very nice and firm and tight and pulled up in there. The right one is showing the differences. So when you start to see people who have difficulty with mobility or difficulty with maybe lifting their arms or their trunk control or being able to put their pants on correctly, their motor, you can see the differences in their motor abilities. They're actually fading and they're not there any longer. And as you can see, the brain is smaller with the brain with Alzheimer's disease, and we're using Alzheimer's disease just because it's the most common of the brain dementias. But you can see with that, in this later stage of Alzheimer's disease, that person has actually lost approximately 1 pound of their brain. So they've lost approximately 1/3 of their brain. So when people tell me, well, my mom is doing this just to spite me, or she really knows what she's doing and she's just doing this because she wants to get the attention. That's not true. You can't fake 1/3 of your brain being lost. So I want you to think about that the next time you see someone or know someone or you're dealing with someone that you love or maybe are just working with, that they're losing 1/3 of their brain. And this is brain failure. This is something that is irreversible, and it's not coming back. And so we have to learn the new normal. If you look at the bottom part of the brain, there's a section, and it kind of sliced it down the side. So I'm going to turn sideways. The brain is looking, I believe, in this direction. This is the front part of the brain, and this is the cerebellum. The slice just goes like this, and then they flipped it. So the bottom one, you can see where it's nice and tight and firm. Everything looks good, and it's intact. The one on the right, you can see lots of holes, lots of shrinkage, and it just looks like it's not quite put together all the way. So if you look at the bottom right-hand slice of brain, look at the left side of that. The left side is where we store our language. So L for language, L for left. That is where everything that we produce goes out, and also things that coming in to make sense of is stored. So the left side of that brain, you can see, is it's a little bit questionable. So when people are having difficulty with their words, they might use one word for another, for example, or not know the word. Can you please give me that, or that red thing, you know, that crunchy thing that, you know, it's round and you You bite it like this. Well, most people would be able to deduct that I'm talking about an apple. They can't come up with that word because that part of their brain is not working right. So if you look at the right side of the brain, and the top is the front part of the brain, just so you guys know. So the right side of the brain is a little bit more intact. That is called our rhythm section. R for right, R for rhythm. That is where things are stored that are things that you might have learned when you're learning language, like the ABCs, for example. Or if I start counting 1, 2, 3, and maybe you would be able to connect that 4, 5, 6. Or the itsy bitsy spider, something along that line. That's where all of those types of things are stored. It's also stored is music. Music is a very, very powerful tool. And it's one of the most powerful tools that you can have to use with your loved one or with the person you're working with dementia. And we'll get to that in just a few minutes. But it's also, so if you've ever known anybody who maybe is nonverbal or their verbalizations are they're not understandable anymore. If you're looking at that and all of a sudden you maybe take them to church and they start singing Amazing Grace, for example, and they're able to sing every word. Although they can't produce that language, they're able to sing, and people just look at it in awe and wonder, how can they do this? It's because there's two different parts of that brain that is where that's located. The rhythm section is the last that usually is affected. And that's why music is so powerful. So they'll be able to recall those music things. Now, it's not any kind of music. It's the kind of music that means something to them. So it has to have meaning, or otherwise it won't work. So for example, if you really like classical music and the person who's caring for you plays AC/DC. AC/DC isn't really going to mean anything to you. It's going to be more of that classical music. And the same thing goes the other way around. The music that we used to think of as music for elderly isn't that music anymore, that genre anymore. A lot of it used to be big band music, Frank Sinatra and those kinds of music. That's not really the case anymore. The Rolling Stones are in their 70s, and that's about the average age of a person who might show signs of dementia. And so they're liking that 60s and 70s music now, some 50s maybe as well, but that's what they're liking. So you want to find what means something to them and play that for them. All right. So L for language, R for rhythm. And you can see in the center of that, that's where our memories are stored. So kind of, it looks like a butterfly on the left-hand side, and it looks big and holy on the right-hand side. Our memories are stored there. So when people are saying, I can't remember, that's really true. Our long-term memories are actually stored in the back of our brain. Which this doesn't show very well. This isn't a very good slide for the back of the brain. But our short-term memories, that's why people have difficulty with short-term memory. All right, so this is a little task for you. I want you to look at these pictures. There's 16 pictures. And by the way, is everyone doing okay so far? You can unmute yourselves if you have any questions. I see.
Yes, we're doing good.
Awesome.
So good.
Okay, wonderful, wonderful. Make sure you're sharing that if you have any questions, okay? All right. So I want you to look at these 16 pictures. And what I want you to do is I'm going to just have you, and if you're working, if you have a partner with you watching this video, you guys can work together. If not, I guess you're on your own. Do not say anything in the microphone yet. And I want you to match up or pair up the like objects. I'm going to give you just a minute to look at it. You don't have to write it down or anything, just kind of do it visually. All right. I am going to give a clue. Maybe. There we go. All right, so the instructions are to pair up the like objects. That's your clue. And I'm going to give you another clue. Keep figuring it, or keep looking at it, you'll figure it out. And you're probably thinking, Kim, those are not very good clues. There's a reason. Method to my madness, I say. And I'm going to give you the last clue, and I'm going to just tell you, you know the instructions, don't you? So, I want to hear from you guys. You guys can unmute yourself if you have something to say. I want to hear how that felt.
It left me wondering who I was. It didn't.
Oh, Stephen, you spoke a little bit. There you go. So Stephen was
out what categories were in, and if I had any type of
Stephen, you're kind of breaking up. I'm sorry, it's not coming through.
Not be able to handle that.
So if I tell you that all 16 of those pictures, nothing of them is meant to be paired up. There are 16 random pictures. So a lot of times when people are looking at those pictures and they're having difficulty trying to pair them up, and I'll ask you about this in a minute, but there's a reason I'm doing that. A lot of times we will use the same thing, the same method to talk to the people that we love with dementia. We will use the same method as far as, Mom, put your sweater on. Mom, I said, put your sweater on. Mom, you know how to put your sweater on, put your sweater on. Does that sound kind of familiar maybe to anybody? A little bit? Yeah, so if we are saying the same thing and get the same response, we're not doing any good for that communication. And I'm seeing some people putting in the chat that it didn't make any sense. It's frustrating looking at those pictures and not understanding what the rules are. Our brain is telling us one thing. Our brain is saying, this should make sense because Kim is a respectable person and she shouldn't be lying to us, so I should be able to figure this out. So our brain automatically goes into trying to deduct that. That's if we have a healthy brain. If we have a healthy brain, where our reasoning and our judgment, which is located up in the front part of our brain, kicks in and says, oh, well, I'm going to go ahead and try to do this. How many of you were able to find a pair? And you guys can chat if it's a little easier than speaking. So it looks like maybe a couple people found a pair. Some people start doing it like the sports and the sports together, two buildings together, exactly. The the round things and the round things. So the eggs and I think they were tennis balls. Oh, yep, there you go. So people start kind of putting things together randomly to try to make sense of what doesn't make sense.
It wasn't random.
It wasn't random. Well, there you go. Our brain actually is trying to do that to make it so that it makes sense of it, even though the directions don't make sense. So along the same line, as we're speaking to our loved one with dementia, we need to change that. We need to change the way we speak because they don't have that logical thinking anymore. They don't have the ability to have that deduction and try to make it make sense. So when you're holding up the sweater or you put the sweater down on the table and you say, Mom, put your sweater on, and they look at you like you have 5 heads, we got to change something up a little bit so that it makes sense for them, okay? So something we can do is we can use, there's 3 different methods. One of them is hand over hand. And hand over hand is literally taking that person's hand and encompassing it with your hand and helping them to be able to do things. This helps them to do something as long as possible by themselves independently. So if they're struggling, for example, getting our sweater on, you can actually put the sweater in their hand and put your hand over the top of it and try to help guide them through that. So hand over hand is one way that is very successful. Typically, hand over hand is used later stages of dementia. There's also hand under hand. Hand under hand is exactly what it says, and you're going to place your hand under and lift their hand up with it. So it's very subtle. If they are maybe getting some soup and they're not eating, so you're going to put their spoon in their hand and you're going to just literally stick your hand up and kind of bring it to their mouth so that they're doing it, and hopefully their muscle memory will kick in and understand what that means. So hand over hand, hand under hand, and modeling. Modeling is when you are actually doing so I'm going to pick up my soup spoon and do it in front of them, or I'm actually going to pretend like I'm putting on my sweater. I'm going to be modeling what I want them to do and have them make sure you're looking at me so that you know what you're doing. Okay? Does that make sense? Yeah? Okay. All right, so the modeling. We're also going to be using verbal cues and tactile cues. So we want to be able to use verbal cues, and verbal cues are used sparingly. 1 or 2 words at a time, or 1 sentence at a time, no more than 1 command at a time. So if I'm asking Mom to get dressed versus Mom, I want you to put this sweater on, there's 2 very different things. Getting dressed is many, many steps. If you think about brushing your teeth, and the next time you are with someone, I want you to explain how to brush your teeth step by step. And think about how many steps are involved with just brushing your teeth. So one of them is putting the toothpaste and toothbrush in your hand. And that's 2 steps right there, actually. Getting the toothpaste wet, getting your toothbrush wet, opening the cap, putting it on. I want you to try to go through all of the steps and see. Or I want you to help someone make a peanut butter sandwich and give them the steps. And look at how many steps it is and break it down as little as you can so that you're doing as little as possible. As few steps as possible. So that's kind of where that comes from. I'm going to go ahead and go back to our PowerPoint. Okay, I just had a question. Will they know the soup is too hot to eat, or is that a function that is gone as well? So that is a great question. Sensory tends to go. It's not present as much anymore. If you look at people who are always cold, or their senses, if you touch them and they scream because they're in pain, or maybe the shower is hitting them and it just feels like nails coming on the top of their body or their head. And that goes for heat and cold in your mouth and in touch as well. So touching an oven or touching something hot might not be the greatest thing, because they don't have those senses in their brain anymore saying, this is hot, remove your hand. Or this soup is too hot, stop eating it, or blow on it before you do that. So you do need to monitor those kinds of things for sure, for safety. Great question. And everyone who's on here is going to get this. I'm going to send this out to you after we're done. This is some communication ideas and tips on how to be a little bit more successful when you're talking with someone. So the first thing is, we need to remember that everything that is associated with them at that moment is part of them. This includes their chair, their clothing, maybe their purse if they have a purse with them, or any of their belongings that are with them presently. That is kind of an extenuation of them. So please be aware of that. Don't remove a purse without talking to that person first. All right. And we'll get to that more in a few minutes. So you're going to always approach that person from the diagonal, from the front diagonal. You never want to approach that person directly straight on. It can be very intimidating. And especially if they're sitting and you're standing, it can be very powerful of you standing and them sitting, and it can be very intimidating and scary for them. You're going to want to approach at their level and making contact with face-to-face kind of diagonally. Now, it doesn't mean that you're going to be crawling up to them, talking to them. Obviously, you're going to be walking, but you're going to get their attention while you're walking towards them so that you're not going to scare them. You never want to approach someone from the back unless it's an absolute emergency. You will get a flight or fight response almost every time. And they aren't able to turn their head quick enough and have their eyes locate where they're at quick enough to understand what's going on. So always come from the front diagonal, lower your body, and be careful of, again, their whole body presence. Their chair, their shirt, their glasses, if their shirt is unbuttoned or misbuttoned, don't just come up to them right away and start working on their shirt, because it really is a part of their body at this point. Making sure you're letting them know what you're going to do when you're going to do it. So, hi mom, I'm getting ready to, let's fix your sweater here because your sweater's a little mixed up here. Let's readjust the buttons. Letting them know kind of what's going on. Something else I want you to think about is, I want you to think about your body and your emotions. And I want you to pretend like you're always carrying a full-length mirror in front of you. You're going to look at that full-length mirror, and whatever you see in that full-length mirror is what you're going to get in response. So even though our verbalizations and our communication is lacking, our emotional senses are still present. So if I approach someone and I'm really frustrated, I've had a rough day at work, it's one more thing I have to do, I'm going to be sharing that frustration with that person, and they're going to be sharing it right back with me. So it's very, very important when you're frustrated or angry or upset to take a step back, and literally take a step back, take a deep breath, and blow it out and reapproach the situation again. Oftentimes, what we know as of behaviors is often just a communication, of a way of communicating. And for them, when you're communicating in that negative way, they're going to respond right back to that again. All right. So speaking slowly, and I'm not going to do this now just for sake of time, but I want you to have someone help you with this when you get a chance. And I want you to have your eyes closed. And what you're going to do is have them time you. And you can switch partners if you can as well. And you're going to just think about the weather, think about your grocery list, think about things you have to do after work, whatever it is that you need to do. Don't count. Don't use your blood pressure or pulse or anything else. And just kind of guess where 30 seconds is. So when you do this, you're going to actually close your eyes. And when you think it's 30 seconds, you're going to just raise your hand. And while they're timing you, then they'll tell you it's 30 seconds. The reason I'm having you do this is because 30 seconds to us right now seems pretty quick. When you're not responding to anything, it can be a lot longer. And the average response time for someone with dementia is at least minimum of 30 seconds. And so when we start talking to them and then start talking to them again about the next subject, they're on the first subject and they might not be able to respond to that. And it can be very frustrating. So we have to slow down our bodies and our communication to meet their needs. So try that when you get a chance. Try to, and even time yourself. You can time it on your phone or something. 30 seconds, and then just wait. And you think when you know it's 30 seconds, you raise your hand and see how close you are. And remember that that's difficult to do when you're in the heat of a situation sometimes. So slow your body down and take a deep breath. We talked about this already, using shorter sentences. Only one phrase at a time. Give choices. Give no more than 2 choices if they can handle that. Sometimes later in the disease process, they aren't able to handle that. But you're not giving them choices that are out of your control. You're giving them choices that are within your control. So for example, if you go up to Dad and say, Dad, would you like eggs or oatmeal for breakfast? You know that you have the eggs in the refrigerator and the oatmeal in the pantry, that you can make those 2 things. By doing that, that's giving them a choice and that sense of accomplishment and sense of belonging. We all need to feel that belonging. And so by having that, it allows us to be a part of our community a little bit longer. Mom, would you like to wear your red blouse or your blue blouse? Or Mom, would you like to, I just totally ran out of ideas. How sad is that? Would you like to wear your blue shoes or your brown shoes? So those kinds of things that are well within your control, but you're also giving them that choice and opportunity to make those choices. This is a big one, this next one. Remember to not use the word remember. I have worked in many assisted livings, many nursing home type facilities, many independent, many different types of settings. I hear this every day. Mom, remember, you know this. Remember, we talked about it 5 times already. I know you know this. Remember. This can be not only frustrating to you, this can be very, very frustrating to that person with dementia. It is crucial that we not use that word remember. And it is something that we have to train ourselves in to be able to do. So Jeff just said that he did the example and it seems like an eternity. It is. 30 seconds is an eternity when you're waiting for a response or when it's quiet. It's absolutely a very long time. Someone also said, don't forget, use these words, and so remember, but also don't forget, which is very crucial as well. It is as if I walked into the room and I had a body cast on or a leg cast from my toe to my hip, and you said, all right, let's go run a 26-mile marathon here. It wouldn't be possible, and you would be setting me up for failure. And it's the same type of thing. You're telling someone to remember or don't forget when they have brain failure, and you're setting them up for failure and frustration on every part. So I'm going to say it again. Remember to not use the word remember. You can change those words by saying, tell me about. Mom, tell me about your doctor's appointment, if that's a possibility. Or tell me about growing up on the farm. Or tell me about, and they might not get to quite the same area and space that you're thinking of, but let them go with it and go with that flow. Join their journey rather than it becoming enforcing it your journey. So also using positive language rather than negative language. And sometimes we have to retrain ourselves to do that as well. Oftentimes, Mom, don't go over there. Mom, don't do this. Mom, don't do that. Instead of saying, hey, Mom, let's go for a walk. So if you see Mom and she's agitated and she's having a hard time, instead of saying don't do something, encourage her to do something that is appropriate, whatever that may be. So, and Sandra D is saying that it does take practice. And you need to remind yourself, catch yourself when you say the words remember, or catch yourself when you're saying don't do this. Stop yourself and rephrase that. And that kind of goes back to what we were talking about earlier about finding that joy. Is it better to be right, or is it better to be happy at this point? And you're going to find more happy moments if you use less of those negative words. One thing is very, very true, and I see this a lot as well. Do not argue with that person. I'm telling you, you will never win. It doesn't go anywhere. But you're validating, you want to validate their feelings. So you can say, I see that you're upset, or I see that you're angry. Sometimes by just naming their feeling that they might not be able to name themselves helps them to be able to refocus. And that's okay. And that helps create that bond and that trust in that relationship even more. And the same token, if you're upset and you've had a really rough day and you're maybe in tears, don't try to hide it from them. If they come up to you and say, what's wrong? And you say, nothing, nothing. Well, again, that emotional sense is still very strong, and they can still understand that. So it's important to be able to share that. You know, I am having a rough day today. Thank you. I appreciate you listening to me. And that's all that needs to be said. You don't have to go into details of what your rough day is, but acknowledging those terms and those emotions is very, very helpful for communication. All right, so I want to show you this mirror because, again, I think it's just really, really important. What you're showing, what you're displaying is what they're going to be seeing and experiencing. And then by that token, you're going to also be receiving it back again. Be very careful. If you're not in a pleasant mood, if you've had a really rotten day, you know, take a step back, take a deep breath, and then retry again. So it is easier for us to change our behavior, even though it's very difficult to change our behavior. It is very difficult to change our thoughts and our thought processes because we're kind of who we are, but it's a lot easier to change ours than the person that we are caring for with dementia. So just be aware of that as well. All right, another activity that I want you guys to do, this is with your paper and pencil. I want you to think about what makes you who you are. Everyone has a story. Everyone's story involves different things. So their stories, I want you to think about the 10 things that make you who you are, the top 10. random, it can be whatever. Without these things that have happened in your life, you would not be the person you are. So, for example, it can be events, it can be weddings, funerals, births, deaths, first job, first car, first kiss, first marriage, second marriage, divorce, whatever it is that makes you who you are. Write down 10 things. Doesn't have to be, no one's grading it. This is just for your own benefit. Bullet points. Don't go into storytelling right now. So I'm going to give you just a second. Write down 10 things. If you have family members that you're putting down, you need to put them separately. So if you, for example, I have 3 children, I would name all 3 of them independently. And I'll give you just a second to finish that.
Kim, what if we have more than 10 kids?
Well, then you have to choose. You have to pick the favorites then. All right. Someone said if you have more than 10 kids, then we pray for you. I could not agree more. All right. So if you have 10 things written down, if you don't, that's okay. What I want you to do is I want you to cross off 5 of them. You choose, it doesn't matter. Cross off 5 items. All right. Now I want you to cross off 2 more. Now, by using your chat system, I want you to put in there what you're feeling. How does this feel to cross off 7 out of your 10 things that make you who you are? So some of the things that are being shared: simple, hurt, loss, it's very difficult, diminished, sad, very sad. So this is an example of, and someone said incomplete. If you can just think about it this way, disoriented. These are amazing words that describe this process. I want you to think about that person or persons that you know with dementia. They have a story just like you have a story. Your story is the biggest thing that you can share with somebody. You know it best. You know your 10 children the best, and you know them inside and out. Whereas someone else came up to you and said, I don't really know 3 of your children, but I do know a few of them, but I don't know them very well. When you're asked, and I want you to think about this too, when you're asked to share about your family or your life or something that you know really well, it feels really good when someone's listening and someone wants to know, right? So it's the same thing with a person with dementia. That's their story and they know it really, really well. They might not be able to handle social situations anymore. They might back away from that communication or to use the word social distancing. Everyone's not heard that enough lately, huh? They start backing away from that social situation because it's uncomfortable, because I'm not familiar with it. I don't know that story very well. But if you ask me about my story, I know that really, really well. So the point this task says is that we got to choose what was on our list, And we also got to choose, although it be painful, what got crossed off our list. They don't get to choose what gets crossed off of their list of their story. They don't get to say, no, I want this whole story. I need this whole story to make me who I am. So for example, having 3 children, what if one of them got crossed off? And I see this all the time, not understanding that that person standing in front of me is my child. And how painful that is, not only for the person who has dementia, but also painful for the family member who's experiencing that. And so we want to be really careful and understanding that they don't have that choice, that it's not something that they're choosing to forget. It is the brain failure again. So it is, it's critical to understand that. Does that make sense to everybody? Okay. So when we're asking people to talk to us, when we're asking our loved one, we need to find what story that they know best. We need to talk to them about who they are. If you have heard that story of them catching that biggest fish 100 times, and every time you hear that story, that fish goes from a minnow to a bass to now we're looking at dolphins, go with it and don't correct them with that. You want to join their journey. A lot of times people will forget the current situations. And again, we saw part of our brain was the short-term memory. So we might have adult children standing in front of us and saying, hi, Mom, you know, I'm your child, and they're not remembering that. And where they're at, they're thinking that maybe their children are 3, 4, and 5 years old. And so when this grown person comes up to me and says, I'm your child, that's very confusing and very scary for that person. So we want to make sure if they're talking about their children that are 3, 4, and 5 years old, as painful as it is to us, we need to acknowledge that and say, tell me about those children. Were they little rascals? Did they get into trouble? Or were they little angels and they sat and played all day long? Talk about those children of what they know right now. All right, so I want to talk a little bit about behavior and about meaning. Behavior is really a form of communication. It is a form of getting our needs met. So if we're acting out and quote unquote, a behavior is showing, something is going on that we need to change or that we need to have changed. So be aware of that. Look at yourself. What is it that they're trying to say? So you now, whether you want to or not, have become all Sherlock Holmes, and I'm giving you your magnifying glass and your hat so that you can put that on and you have to figure out what's going on now. Looking at what is it that you're trying to tell me? Is it the environment? Are you too hot? Are you too cold? Are you hungry? Are you thirsty? Do you need to go to the restroom? Are you uncomfortable? Are you in pain? You're looking at all of those kinds of things that would make behaviors happen.